Hi, I'm Dr. Sreenath Manikanti. I'm Senior Consultant Neonatologist and Pediatrician at Kauvery Hospital, Electronic City, Bangalore. Often, new parents have lots of questions regarding newborn care after the baby is born. First and foremost, keep the newborn baby warm. Have 2 layers of clothing and use only cotton cloths and avoid woolen cloths. Keep the room temperature approximately around 24-25 degrees. If it is a premature baby and less than 2.5 kilos, give skin to skin care with the mother, that is called kangaroo care. That will help the baby to gain more weight and also maintain the temperature better. Next is the breastfeeding. Breastfeeding gives complete nutrition to the baby, including preterm babies, until the baby reaches 6 months of age. After 6 months, it is advised to start complementary feeds with the continuation of breastfeeding. First few days are very important to establish breastfeeding in these newborn babies, and it is important to take the help of the elders at home or nurses in the hospital to get confidence while establishing breastfeeding. Do not lose your heart if initial breastfeeding is little difficult. It will take 2-3 days of efforts for breastfeeding to completely establish itself. Keep feeding the baby on demand. Every time the baby cries, put the baby on the breast. If the baby is sleeping for a longer period, make sure that at least you wake the baby at least every 3 hours and feed the baby. And watch the wet nappies. If the baby is having regular wet nappies, that shows the baby is getting enough feed. And we would monitor the weight gain of the baby. Initially, all the babies lose weight in the first week of life, and then they start regaining weight by second week. Parents do have a lot of questions about jaundice. Jaundice is very common in newborn babies. Most of the babies are jaundice at some point, but not all of them will require treatment. Very few babies require treatment if the jaundice levels are above the cutoff line for the age and gestation of the baby. Please consult your pediatrician with regard to the management of the jaundice. With regards to nappy care, please do change the nappies regularly every 4 hours, and try and avoid not to use wipes in the first couple of weeks. You can take a warm bowl of water and take cotton wool and dip it and then gently wipe it. So another important thing is to make sure that your baby receives a vaccination at birth. All babies should receive BCG injection, oral polio drops and hepatitis B injection. And also make sure that your baby has a newborn screen done at birth to rule out any metabolic conditions. And also get your baby's hearing checked.